So, greetings, colleagues and friends. Thank you for joining us. I'm Kumanan Rasanathan, the Executive Director of the Alliance for Health Policy and Systems Research, and welcome to our webinar today on the state of health policy and systems research, priorities, methods, and impact. And Jeff, you can stop sharing the slides for a moment. So, today's session is very much, as it says, to think about what has this field achieved over the last several decades, but more to the point, to consider where are we going. We live in a world that is changing dramatically, often for the worse, but there is also grounds for optimism. And today's webinar links to a collaboration between the Alliance and Health Systems Global, looking at the state of health policy and systems research. We're very grateful for the support of the Department of Health and Social Care, the NHR, with the government of Great Britain and Northern Ireland for providing support. And at the Alliance, we're also grateful to the governments in Sweden and Norway who provide support for everything we do. And for this work, we are hoping to produce 3 papers looking at the state of health policy and systems research. And each paper will focus on a different aspect. One paper looking at topics and priorities, one paper looking at methods, and another paper looking at practice and how can health policy and systems research have greater impact in changing policies, in changing the practice and the strength of health systems, and ultimately improving people's health. So today, we will discuss each of those aspects in turn. There'll be presentations on the proposed work, and then we have some wonderful discussants who are leaders in the field, friends of all of ours, who will then reflect on where we are in these areas. And then there'll also be time for discussion with all of you, and we look forward to your inputs to shape this work. Before we start, if we can reflect on where we are as a field, we often sometimes still say that this is an emerging field, and I don't think we should do that. This is a field that has now existed for several decades. This is a field where, in Health Systems Global, for example, we can say that we have members from over 100 countries. So there are people in over 100 countries who do health policy and system research. This is a field that has documented impact on policy reform, on changes in service delivery, on changes in the way we conceive and structure health systems. So perhaps we should be less modest about our achievement. At the same time, it is true that the field is not well understood by all. It is true that the field is not always well supported financially, and we're in a moment where those weaknesses become even more difficult. So we do feel it's timely to reflect. If we can look back upon our history and think on the genesis of the field, this type of work has existed for much longer than it has been called health policy and systems research. But if we look at the moments in the 1990s, which led to perhaps a codification of the field, and to structures for the field, including the Alliance and leaders like Professor Anne Mills, Jill Bolt, and others, who really set the scene. The creation and expansion of the field was in response to an identified need. The 1996 WHO ad hoc report on health research identified that there was insufficient health policy research, health systems research being undertaken in low and middle income countries, and that this was an obstacle to the achievement of health tasks. That addressing the no-do gap was important, and that directly led to the formation of the Alliance in the 90s, and the idea that there should be a global body, however small, that could support the field to grow. In 2004, there was the Mexico Summit on Health Research that was hosted by Julio Frank, who was then the Minister of Health of Mexico. And that led to the Mexico Statement, which asked for 3 things. It said that there should be more health systems research. It said that there should be national health research agendas and that countries should prioritize this to improve health. but also improve economic growth. And it called for clinical trials registries. And that was 20 years ago. And so in the sense that we have moved forward in many ways, in that health policy and systems research is a recognized field, there are institutions in many countries who are now world leading. And there are some countries that are investing domestically. So if we look at the likes of the Ghanas, the Thailands, the Mexicos, the Chinas, even the Indias increasingly, there is domestic investment in health policy and systems research. So much has been achieved, but at the same time, there are still a lot of struggles. Most countries are not investing domestically in health policy and systems research. And what we're seeing with the current retrenchment in global aid, that leaves institutions very vulnerable. I've talked to colleagues in many countries over the last few months who are very worried about the sustainability of their institutions as the US and other European donors withdraw. And there isn't necessarily an easy solution for that because domestic fiscal space in the states sector is very low. So it's not like it's easy. As one person said to me, well, Kumana, it's very hard for me to persuade governments to invest in health system research where there's so many emergencies and we're literally trying to keep people alive. So these are very real challenges. Secondly, health policy and systems research is well known in our field, in our communities, but even within, say, WHO, it's not necessarily the case that everyone knows what health policy and systems research is or why it's important. So we still have a way to go. And then in documenting impact from our field, that has been something that's been challenging. Often we prefer the qualitative to the quantitative. That's very important. We are people who are systems thinkers. We embrace complexity. But really articulating simply what does our research change is often challenged. And in this new era, where there may not be dedicated health policy and systems research funders who understand the value of the field and know the value of the field, that may place us in a very difficult situation. And then finally, what we're also going to talk about today, the world is changing very rapidly. Health systems are changing very rapidly. We may be sick of the word polycrisis, but it's true that our health systems are dealing with, often poorly, dramatic transformations in our societies. So whether that's the realizing of what we've been talking about with climate change and tipping points and what that means for changes in health disease burden, or even just disruption in the ability of people to access health services, what that means for health workforce. The demographic changes, the aging of populations, and what that means for health and social care. The fact that the epidemiological transition is complete in most countries, and how do we deliver chronic care for non-communicable diseases, and also chronic care for people with HIV and TB, for example, who also have multiple pathologies and have chronic disease there as well. How we deal with digitalization and artificial intelligence. How we deal with conflict. We live in a world where for the last 15 years, conflicts have been increasing, as we all know, where so many people live in parts of the world where their health services are in conflict scenarios. They may not be getting health services from state-regulated or areas or where the state even has jurisdiction. What does that mean? And we know that forced migration is moving. We know that there's increasing migration of health workers. So many different challenges. And then even the very basis of social cohesion and the polarization of societies, the trust in experts, the trust in the state. And often it doesn't seem that our health systems are engaging with these changes rapidly enough. They're struggling. Health funding globally for health systems decreased over the last couple of years for the first time in a generation. So in this milieu, what does health policy and systems research have to contribute? Are we focusing our research on the most important problems? Are our methods engaging with the changes to what's happening with research, including digitalization? And are we being accountable to make sure that our work does what we aim to do in terms of improving health, realizing about health, and improving health equity? So fortunately, I don't have to, as ever, answer these questions. I'll hand over to my colleagues on this webinar and then also to all of you. So to start off with, I will hand over to my colleague, Dr. Robert Martin, who will then present on the first aspects of the work that we're doing on priority topics for health policy and system research. Over to you, Robert.
Right. Well, thank you very much coming in. It's truly fantastic to be here, to see so many friends and colleagues online. We're really looking forward to this conversation together. I think it's a privilege to be part of this group and have such an engaged and thoughtful conversation. So I'm going to start by presenting a quick overview of paper one. And then we will hear some reflections from Karen Greppin and Kabir Sheikh, which I know will add important perspectives to the conversation. So if we could have the next slide. So paper one is focused on key topics for the field. But before diving into those, I think it's important to pause, to step back and reflect on the broader global context in which this work sits. And really Kubinin started to allude to some of this, but I think without grounding ourselves in the realities of today's world, it's difficult to appreciate, why this paper matters and how we can structure these conversations to make sure that they're most impactful. So next slide, please. So as others have said, we are now living in a brave new world. Countries are retreating from international commitments, building walls, sometimes literally, sometimes figuratively, drastically reducing budgets for global work. It's not only undermining multilateralism and solidarity, but it's eroding foundations of trust, and cooperation that I think our field has long relied upon. At the same time, there's growing skepticism, mistrust in science. This is really worrying as probably evidence and evidence-based policy making are needed now more than ever. Even the principle of equity, something that we once almost saw as universal, is now increasingly contested. And so, as some of my colleagues recently wrote in a Lancet commentary, we are indeed entering a new era of global health. It is an era marked by disruption, unpredictability, chaos, and sometimes outright resistance to global cooperation, collaboration. But it's also an era that I think opens up space for rethinking assumptions, to innovate, to also have the chance to kind of reimagine what our field could and should look like for the future. So with that in mind, I want to then talk about what does this mean then for paper one, right? If we could have the next slide, please. We know that health systems are fundamental to creating health and well-being, yet the events of the last few years have exposed, I think, just how outdated or even in some cases anachronistic our current understanding of health systems has become. The boundaries of health systems are no longer static. They are rapidly evolving, changing, expanding, being challenged. We need to keep up with that pace of energy and change. So, for example, think about the role of digital technologies. Social media and digital innovations are not simply communication tools. They are transforming the fabric of how we engage, how we work together across governments, the private sector, and communities, people. They're changing how communities experience health, how misinformation spreads, how trust is either built or broken. And then I think these shifts demand us to rethink how we are analyzing health and health systems, how we're doing health policy and systems research. Because our dominant frameworks, I think, remain stuck in some of our older ways of thinking. They are often centered on access to medical services or financial protection. Of course, these are important. These are key metrics for universal health coverage, but they're not enough. They fail to capture the broader determinants of health, the complex realities of power, politics, process. They overlook inequality and cross-sectoral changes that are now, I think, shaping our health systems and health outcomes every day. Today's world really presents multiple intersecting crises, as Komenin said, the polycrisis. We are seeing the rising burden of non-communicable diseases. Of course, we had a high-level meeting last week in New York to attempt to address this. These are often linked with social and commercial determinants that extend far beyond and outside the health sector. We continue to see the accelerating climate crisis. We are seeing challenges in global health financing. And again, Kumanan mentioned this, the shrinking budgets and shifting priorities. Alongside these, we're grappling with opportunities and risks of artificial intelligence, rapid urbanization, population aging. I think forces that, of course, will also shape the future of health systems. So paper one will examine these shifting dynamics in detail. It will not only document the challenges, but consider how our field, how health policy and systems research can rise to the occasion. Because HPSR does have something to offer. It is, the ability to analyze complexity, to bridge disciplines, to connect evidence with politics, to understand the how, to make visible the voices and experiences of communities often left out. So our view, our aspiration with this first paper is really to broaden HPSR's remit beyond a traditional narrow view of health systems. We want to show that HPSR is not just relevant, but absolutely central, that it is key, crucial to addressing both the challenges of today and those looming on the horizon. And so if we could have the next slide, please. So to do that, we will, with this paper, focus on three guiding questions. And these are, what are the major health challenges in which health policy and systems research should engage? How do these differ from those of the past? What can the field of HPSR uniquely contribute to addressing these challenges? And how can it best demonstrate this value? And then third and finally, how can the community, how can we organize ourselves? How can we evolve and position to seize these opportunities and close some of these long, persistent, chronic gaps? Big questions. If I could have the next slide, please. Our approach will be multi-pronged. We will conduct a literature review. We will consult with experts both within and beyond the field. We will complement this with a bibliometric analysis to map how the field has evolved and try to understand where it might be headed. And kind of triangulating across these methods will hope to generate a picture that is not only evidence-based on where we are, but also kind of forward-looking, aspirational, and practical. So that's an overview, a quick, rapid overview of paper one. To set the stage for our conversation, I'd like to pose a few questions for Karen and Kabir to reflect on. And these are here, what do you see as the key topics for the future of the field? Do you have suggestions for how we might best identify and prioritize these topics? And really, kind of how could or should the field evolve to engage meaningfully with these? Karen, I see that you're having some challenges with your video, so maybe we should just start with Kabir. We have about 10 minutes, but Kabir, really looking forward to kind of your comments, reflections, and thoughts as a leader in our field. So Kabir, over to you.
Thank you so much, Robert. I think many of us know each other in this room, but to quickly introduce myself, I am Kabir Sheikh. I work at the UCL Global Business School for Health, where I lead the work on health systems and policy. Previously used to be at the Alliance, so these are all my colleagues. So thank you very much, and big congratulations for bringing this together. I think really ambitious paper, but also timely because some of the kind of stock-taking work that we did was around the field has now lapsed, and we really need to think anew about how we frame the field and signal some of the milestones and going forward. So I'll make some very brief interventions now, and then hopefully we can address more in the Q&A. So my first broad comment is on the framing and the premise that we look at. And I've seen that the paper positions HPSR in terms of its potential to improve health and well-being, and clearly, that's WHO's agenda. And so of course, it makes sense to anchor from an alliance perspective to anchor that within WHO's goals. And of course, it's important. I mean, none of us would deny it, but I just wanted to signal some risks to not specifically to that link, but to framing HPSR as a means to an end. But also, rather than recognizing it as a scientific field in its own right. In particular, I just wanted to highlight the first objective, which, I mean, clearly there's been a conscious choice to frame that around identifying key health challenges. But I just wanted to highlight that this does carry some threats with it, because what it does is it risks re-verticalizing our understanding of the field. It pulls us towards particular diseases or conditions or even determinants, which is a phrasing that I appreciate and has brought huge value to our field, but I think has certain problematics which are too complex to discuss within 5 minutes, but I can deal with those in Q&A. But more specifically, this framing around health challenges has the potential to undercut the field of HPSR's links to the broader agenda of horizontal system strengthening, which has been one of its core driving values, one of the kind of big impetuses for the field, alongside health equity, of course, and there's other values that underpin, but I think these are two key driving motivations. We've already signaled the importance of highlighting the maturity of the field. So HPSR is a science which is moving now beyond adolescence towards adulthood. I think we're all agreed on that, and Kumaran mentioned that as well. It's got its own organizing principles, its own contributions. What it doesn't have, I'll signal that in a little bit, and that's maybe what we could be moving towards. So an alternative, I'll come to that, but just an alternative framing instead of health challenges would be to identify instead health systems challenges and health policy challenges. And these are, of course, the enduring cross-cutting challenges, which we might find ourselves in a world which seems to be ridden by crisis. But if we actually explore some of these themes, they are pretty consistent. There are some new themes and there's some old themes, and we shouldn't also neglect the old themes which have not yet been addressed. So I'll signal some of those. You've already addressed many of those. I think inequities and rising healthcare costs, the state, commerce, citizen nexus. I think that triangle, that circle of determinants, I think is crucial. Workforce dynamics and constraints, the new information ecosystem, the issue of resource mobilization within existing political economies. And then there's long-standing unresolved questions, decentralization, horizontalization, the unfinished, the special overemphasis on specialization and the neglect of the primary healthcare focus. So we can't just ignore those themes because they still haven't been solved. So I think framing the paper this way could highlight some of HPSR's distinctiveness more and its maturity. Second, on building from past science and the past work that's already been done, I think it's very important we don't give the impression that HPSR is only just beginning to address these issues. So the topics framing has some limitations, I believe. There's been a lot of work over the past decades. So it would be important not to just restate themes, but also to signal what is the maturity of the field. So maturity comes then if we identify certain typologies and theses that have been developed as synthetic efforts from all the work that's been done by all our colleagues over the last 50 years, and to position the field as a cumulative theory building science rather than as a reaction to a set of problems. And this would also help us to identify gaps. So let me just identify one significant gap that I see, and that's on health systems innovation. And in many contexts, we see that health systems function and are sustained through innovations. Innovative workforce strategies, new forms of citizen engagement, innovations in financing. While there's a lot of talk that we undertake about tacit learning and learning from action, it's not still apparent how we capture those innovations from real-world health systems and how we translate them across contexts. And there's not even a shared understanding of what constitutes health systems innovations beyond applications of technology, which is a very limited perspective on innovation. And the third and final point I'm going to make is on demonstrating value in advancing the science. So I still feel that the best case, I mean, there are different ways in which we can demonstrate value, but in this setting, when we are talking about advancing the science, the best case we can make for HPSR and for its sustained resourcing and support is to showcase the strength of the field itself and the advancement of the science, which has demonstrable local effects, as Kupanan highlighted, as you've highlighted. But what we should resist, I think, is the short-term temptation to identify the value of HPSR as though it were a discrete intervention. So it would be great to see the paper and the broader initiative highlight opportunities to showcase advancements in the science of HPSR and its strengths. Many of us actually on this call are engaged in contributing to a handbook of research on health systems with a focus on the global south. We at UCL, our group is also convening a series of dialogues on health systems transformation. So we'd be happy to collaborate, bring some of this synthetic thinking about the field into the discussions with the Health Systems Global and the Alliance into the symposium possibly. So those are things we could discuss. So I'll stop here, but just a final word, sorry to end on a slight note of caution though. I think there's a real risk to the survival of HPSR if we allow it to be defined very narrowly as a subset of global health. Global health itself is a shifting configuration, and as we are seeing, it may well erode in its current form. But on the converse, health systems are not going anywhere. They remain central arenas of political life, industry, social life, and they're a big slice of society. They'll continue to demand analytic and scientific engagement. So the strength of HPSR lies in its ability to find a language and a home across these changing configurations. And if global health becomes too limiting a frame, it will find other homes. So anchoring the field too closely to global health trends and configurations can create a number of constraints that I would suggest are best avoided. Thank you, Robert. Back to you.
Excellent. Thank you so much, Kabir. I really appreciate those insights on framing, on innovation, on value, on some of the risks and challenges going forward. Thank you. Karen, I think you've speaking of technology, I think you've fixed your situation there. Are you able to offer some reflections as well?
I did, and I can. So I apologize for having to disappear 3 or 4 times in the last few minutes, but I'm back. Turns out if you just reboot, it works. So that was the final strategy. Anyways, yes, thank you. It's a real honor to be with everyone tonight, to have a chance to reflect on this paper as well as some of the other papers that will be presented afterwards. I'm not going to try to compete with the list of topics that Kabir has been able to identify. So I'm going to take a slightly different tack on this. Mm-hmm. So we were asked to sort of reflect on, are the right topics and what else should we be doing? And when I received the abstract, the outline of the paper a few weeks back, I noticed that there were no methods described. This paper, as opposed to the other 2 papers that will be presented later tonight, is actually the research paper. The other 2 later tonight are these kind of methodological type musings or sort of slightly more commentary type papers that are to be developed. And so that means this is the research paper. And in your presentation, you did talk a little bit about what your methods are, but and I guessed kind of correct of what you would probably do is you'd probably come up with some sort of actually I didn't even have this framing, some sort of framework, and then a literature review, blah blah blah, and that's not as straightforward as it probably needs to be, because by virtue of putting words that you're going to search for, you are essentially constraining, you are essentially framing. We don't know what to look for. And basically that's what you're asking us, is what should we be looking for? And you kind of need those things in order to do a search. And so, I don't have the right answer to this. We've struggled with this in the past. A couple of years ago, I was involved in an effort trying to find, to define funding for health policy and systems research. And we similarly had a struggle with what does health policy and systems research mean? What is research? And so I think you will very quickly come to a challenge in that you have to kind of know what it is you're looking for, and that's going to be defining what you're looking for. And so I think my first comment is really, maybe open that up a bit more. I also think there is some risk of focusing on the literature and the gray literature. I think there is a lot that we have learned in the field of HPSR that hasn't been written down. And so I think, it's great to see you have these small expert consultations, but I think, again, going further, thinking about practitioners, thinking about what they've learned and how they apply this in their practice. The second point I want to make is with regards to the language that we were asked to reflect on, which is about what are the most pressing issues. And again, now I'm into another, I think, sort of challenge I think you might get into is what do we mean by pressing? We could think of, for example, what's current. We could think of maybe what's biggest from a kind of global burden of disease kind of perspective. But I think we all would be very quickly to realize that if we do that, we're suddenly in a world in which we are probably overlooking what are the real pressing challenges that we don't even know about yet, or we know about them, but we don't know how to think about them. If we had done this 10 years ago, we probably, wouldn't have focused as much on pandemic type issues. Clearly, the world didn't do a great job in terms of preparing for the pandemic. 10 years ago, that wasn't the most pressing issue, but in hindsight, maybe it should have been. So how do we think about that? And then my third point I want to make is really trying to look across the three papers. So I'm kind of skipping ahead a little bit. I hope this is okay. But this paper is really looking at topics, and we're going to hear next on a paper that's going to be looking at methods. And then we're going to look at a paper that's going to be looking at sort of the process of doing these things. And I think these are all the right things to do, but that skips what I think is a really important issue. We are kind of engaged in a bit of a kind of epistemological musing or navel gazing exercise of trying to decide what our field is and whether it's where it is and all that type of stuff. But where's the evidence? Where are the questions about what constitutes evidence in our field? I think it's still a big challenge to be able to say that we're at a point where we can say that, because this is working in one place, we can do this somewhere else. Like we really are in a stage where I think even that kind of learning, that kind of knowledge translation isn't there. So I think whether this gets built into the topics, whether this gets built into the methods or the other papers, I think there needs to be a little bit more thinking about what is it that we're looking for here as well in terms of the outcomes or the evidence from this type of research. So those are my 3 points, and I'll stop there.
Well, Karen, thank you so much. I'm glad that you were able to reboot and join us, share those reflections on methods, on thinking about what are pressing issues, thinking about the connections across the papers, understanding, what is evidence, what are the types of learnings that we are using as a field. Thank you very much. It's now my pleasure to hand over to my colleague, Dr. Aku Kwame, who's going to present on paper 2. Aku, over to you.
Thanks very much, Robert and colleagues. Greetings. It's wonderful to have this opportunity to speak with all of you. And I really appreciated the reflections also from Kabir and from Karan as well. So let me very briefly share with you some of our preliminary thinkings on a paper that focuses on theories and methods for the field of health policy and systems research, and to actually tug on some of the threads that Kabir's laid down in terms of thinking about the field in its own right, thinking about the science of the field, and how do we actually articulate the field in that way. Next slide, please. So I wanted to actually start again with a little bit of history and just cast our minds back to the period around 2010, when we really began to, in response to all of the investments in health system strengthening, really forcefully begin to articulate what we thought health policy and systems research was. And many of us will recall that in 2011, there was the trio of papers from the PLOS medicine series, where many of the co-authors are here. Kabir, Lucy Gilson, Sarah Bennett, Prof. Irene, Prof. Freddie, and many others really put forth the sorts of questions that we need to be asking, the way to articulate the boundaries of the field. And that trio was so vital to so many of us who were much younger at the time, but really getting into the research around health systems and health policies. And since its inception, the Alliance has always had a function of putting forth readers, manuals, texts that support thinking through how do we codify the methodology of health policy and systems research. And so you can see some of those readers and flagship reports and manuals on the screen. In 2009, we had the flagship report on systems thinking. In 2012, we had the methodology reader, co-edited by Lucy Gilson and Marsha Orgill and others. But what was very important in this reader was that it, in its beginning phase, really put forth the thoughts through how do we think about conducting health policy and systems research, and then had a collection of real exemplars, methodologically speaking, looking at methods like ethnography, impact evaluation, cross-country comparative analysis, action research, and others. And so this was really the first time that we had in one place a tool that helped us look at, helped us think through designing our own research, helped us teach HPSR. And then that was followed by a series of other methods around participatory action research, around policy analysis, and others. And what's interesting is that as the Alliance, when we in 2021 produced our first partners report, one of the questions in that report was around trying to understand, is the definition of health policy and systems research that we are using the same, or has it changed? And one of the findings of that report was that, in fact, in countries all over the world, the definition hasn't changed. People still have a consensus that that definition that we use of HPSR being a multidisciplinary field consisting of, and then listing all the different disciplines, that wasn't changing. But what was rather changing was the way that definition gets implemented in various countries based on the organization of the health system, based on how health research is funded, based on organizational capacities, so on and so forth. And more recently, many of you will recall back in March, I believe it was, the webinar that we held looking at the state of health policy and systems research. And there were a few new concerns that came up from that convening, where we brought together many thinkers in the field, thoughts around the new kinds of institutional forms that were taking place. Where is health policy and systems research taking place? Not just in the academic sector, as has traditionally been. Thinking through how do we better build and test the theories that we are using, and how do we actually place more emphasis on practice-informed theory in health policy and systems research? How do we build a better systems praxis? Many of us speak about being systems thinkers, but do we actually fall back on systems science, on systems theories, and on systems methods, for example? And then in response to what Robert has just presented in paper 1, in order to respond to these new but also old priority questions, are there new or underused methods and theories that we can better draw on? And so this really is these are the issues that paper 2 is reflecting on. Next slide, please. So what we want to do in paper 2, and as Karan has said, that this paper is not an original article. It is a paper that really sort of muses on the methodologies. We want to ask this question of what new and underused theories and methods should HPSR be drawing on in order to respond to the current priority topics, and how does that lead us to better impact, to stronger science? And how do we do that in such a way that is future focused? And so our discussions already have raised the issues of, yes, there are gaps that we have. There are gaps that we may not know that we have, but how do we look at the future to think about this issue of articulating the science of health policy and systems research as a field, in terms of the kinds of theories that we are using to base the methods that we use in the designs and the evaluations that we conduct in the field? And this paper really does seek to target researchers who want to understand the suite of methods and theories that they can be drawing on in designing their studies. Next slide, please. And so in terms of the 2 or 3 musings that we might be thinking through in this paper, there's one sort of musing which is around this idea that we need methods that are better theorized, and we need to be much more methodologically clear when we are considering how we design and how we evaluate our health policy and systems research. And so how do we do that? And then secondly, if we are going to move into an era where HPSR is truly transdisciplinary, that it is very strongly recognized as an applied field that is fit for the future, then there are some methods and theories that perhaps we have underused that we can better use. There are perhaps some new and emerging theories and methods that we've not used that can now be considered to be integral and part of health policy and systems research. And in just our preliminary thinking, and this is where I'll close, is that we have a sense of what some of those which domains we might theoretically and methodologically be drawing from. Applied systems thinking, for example, better work on quantitative approaches, thinking through knowledge uptake epistemologies. So touching on the points that Karen raised earlier about how do we, what is our ontology and epistemology of knowledge, and how does that actually underpin our policy engagement and our knowledge uptake activities? Looking at various social theories that we've neglected. Thinking through theory-driven evaluation, and even though in the past few years there's been much more appreciation of co-production, co-creation, and co-construction, how do we understand this better and bring in more lived experience? And especially getting to that issue of practice-informed theory. So these are some of the domains that may be obvious to us. There are some that are perhaps less obvious to us and maybe necessary for us to consider. Are there theories and methods in machine learning, in legal or justice fields, in ecology, and even in gender? And I put a question mark there, because have we done enough in terms of gender transformative, have we applied enough gender transformative approaches in our health policy and systems research? So with that, I'm delighted to invite our 2 discussants for paper 2. We've got Asha George and Bruno Marshall, deep methodologists. And so again, we have 10 minutes and I'll give 5 minutes each. Asha, I wonder if I can start with you, please, and we can go to the next slide. Thank you.
Thank you, Aku. What a privilege, and thank you for inviting me to this discussion and conversation. I'm Asha George. I'm a professor at the School of Public Health at the University of the Western Cape in South Africa. So one of the first things that come to mind is, I think this is a great opportunity to restate the case, as Kumanan said, on what is HPSR, why is it important? But I was struck by the framing of this piece, because I was wondering, and I know this is a hallmark conversation, is it methods or is it methodological orientation? Are we worried just about form or the substance of our learning and our engagement in strengthening health systems? And I think we've always said it's how you frame questions that matter. It's not necessarily, you've outlined such a diversity of approaches and methods. And I understand that can be confusing, that people might find our field, they want something more fixed. They want a framework or something they can hold on to. And being so open in terms of all the different disciplines, all the different methods, can be disorienting, given how public health is taught and structured. So in that sense, I think it's important to go back to why. Why is our field, what makes our field special? And I think the reason why we focus on methodological orientation, or how you frame questions, rather than delineating specific methods, is because, and I thought of this in terms of 5 Cs. Currently, we have a lot of complexity, this understanding that we have complex systems, but the world is much more complex than we had anticipated before. We need to be grounded in context. I think these are all the things that make HPSR such a valuable endeavor. It can handle that complexity. It is based in specific contexts and an engagement, a critical engagement with those social contexts and how health systems function in specific contexts. That critical engagement that supports change. These are not fixed things, but they're systems that are dynamic and they're constantly changing, often by forces in which program managers, health workers, policymakers have very little control over. And in that sense, it's also something, it's a field that really lends itself to collaborative learning and reflection. So those are, I think if we can restate why it's important to have this openness, is because we're dealing with issues that are complex, that are context specific and need to be addressed, and that contextual richness needs to be understood, but that critical engagement to work collaboratively in supporting change is critical. And that goes beyond whether you can do that from surveys. How you use the knowledge from surveys to support that endeavor is the key question. It's not that qualitative research. I am a qualitative research by calling, but it's not just qualitative research that is valuable for this. I really believe you can use other quantitative methods. It's the framing of that question and how they're applied. And so clarifying the why, I think, is really important. I'm struck by, there's this push for more explanatory theories, and just reflecting on my own experience of doing research that challenges power, sometimes even good description can be challenging because stakeholders have very different perspectives about something that you think you should be able to describe easily, but actually there's a lot of dissonance. And I think another part of the why of what makes our field special is giving voice. It's research that surfaces these different perspectives and helps us better understand those different stakeholders, those different voices, because health systems is a collaborative endeavor. And I think a key thing in supporting change is changing the frame. Is there a different way at looking at the particular problems we're looking at? And we get that from listening more carefully, research methods that ask more critical questions and that enable more listening and learning to change frames. And so all of that is linked to your third paper because it's research that is based on relationships and relationships that happen, that build trust over time. And I think that allows you, for instance, Leanne presented the other day to my colleagues, arts-based methods. They require a lot of facilitation, but it's based on relationships of engagement so that people trust you as one amongst several knowledge brokers in the health system. I think that's really valuable, particularly in today's world when evidence is a loaded term. Karen mentioned, where's the evidence? We live in a world of disinformation. And so bringing back to how do we have approaches that ensure trustworthiness of our evidence and legitimizes knowledge that has been excluded, legitimizes certain voices that don't have a place at the table is key. So I think our orientation and our methods need to be open to that. I think in terms of, and in that sense, it's engaging with the politics of knowledge head on, and acknowledging that and being more clear where does HPSR add value to that? In terms of, I'm just going to wrap up on 2 points linked to the other papers. I think in terms of topics, I was really struck, Aku. Obviously, I have a background in gender and human rights, but I was struck that the overview that Robert presented didn't mention the backlash on sexual and reproductive health and rights and gender equality. This is different from before. It's not just how societies are dealing with social norms and change. It's a politicized movement. It's politicized and organized, and it's a very different, what's happening now is very different from how social change, how societies have evolved. And I think it's not necessarily, the Alliance might not necessarily lead on this, but how does it be an ally in recognizing that health systems has a role to play in especially in the complicated world we live in, where human rights are down, how do I say, discarded so easily in the power politics of the world. And on the last topic, I'm really looking forward to hearing what you'll be doing. I was just remembering Shay's piece on dignity in research, that part of the reason we are able to support change and strengthen health systems research, health systems through collaborative efforts, is through that emphasis on dignity and who has knowledge and how do we create a basis in which research can be seen as extractive. And unfortunately, in today's world, we just recently presented to the District Health Management Committee, and the first thing they said is, well, I hope you come back because researchers come all the time, ask us questions and leave. We really need to think more, go beyond just the nice words and really hold ourselves accountable. How do we bring that element of dignity back to contributing to strengthening health systems, in legitimizing different voices, but also holding ourselves accountable? I think that trustworthiness in methods comes from how do we hold ourselves accountable as players in strengthening health systems. Over.
Asha, thank you so much for those rich reflections. I know that you're already stirring a lot of thoughts in the colleagues who are online, so we'll take the Q&A afterwards. But Bruno, let me give you the floor now as well. Thank you.
Thank you, Aku. My name is Bruno Marchal from the Department of Public Health at the Institute of Tropical Medicine in Antwerp. That's quite interested in complexity. So I think, in fact, it's a good moment to take stock of what we did in the last 15 years. I won't repeat too much what has been said already, but I think we saw definitely an infusion of methods and theories from social sciences, basically, and perhaps also political sciences, which was one of the calls made in one of the 3 PLOS papers. I think we saw also much more uptake of systems thinking, notions of complexity as well in the field. And then I think perhaps more importantly, perhaps an increase in the diversity of researchers, and not only in terms of non-public health people coming in, people from the different kind of other disciplines, social sciences, political science as well, public administration perhaps, anthropology, critical anthropology. Then also diversity in terms of people coming from non-positivist backgrounds, which I think also enrich the field. And last but not least, much more research being done by researchers from the Global South and being represented, in fact, in the community, which has really brought its own set of new methods and new viewpoints and new experiences. But at the same time, I'm wondering if we didn't reach a ceiling. And I think in the last 2-3 global symposia on health systems research, I found we kind of reached a ceiling in terms of the use of methods, but also the use of theories. And so instead of perhaps asking the question, which kind of theories should infuse our choice of methods, it's also what kind of methods actually do we need to build better theories? And so that kind of goes to the point Asha was already mentioning to some extent. Yes, context is important, but science is also about transferring knowledge. And so more concretely, for me, the the main attraction of coining this field of health policy and health systems research was the kind of open and wide recognition that health systems are social systems and therefore complex systems. And so there are a number of reasons why we kind of developed this field of health policy and health systems research, but the notion of complex causality, I think, was quite an important one for me. And so, as I said, we use more methods and terms and concepts from complexity thinking and systems thinking, but there's definitely a next frontier at that level. And I think the focus should be now in terms of methods to deal with the complex causal pathways. And so both health status as such, as well as anything we do in health services, in healthcare, but also implementation of programs, the design and implementation of policies, the health system organization as such, it all deals with causal pathways that are complex in nature. And I think we've seen more use of concepts of complexity. Yes, we describe better the complex systems, but do we really understand the changes that are necessary to transform these health systems, which are complex in nature? So I think here I see a number of priorities in terms of methodological development. One being, how do we trace causation across levels? So both from the micro community household level to health services, to the local health system, to the national health system, to the global level, if you want, so within the health system, but also across these different layers of determinants of health and of the health system in terms of the political environment, the contextual factors that are economic in nature, social in nature, but also ecological, of course. So multi-level, multi-skill analysis, I think, is definitely lacking in our field. The second one is, how do we trace causal pathways over time? So again, we've been getting better at describing situations as they happen right now, kind of cross-sectional snapshot moments, but the studies that are really tracking issues over time are quite rare, leave alone studies that actually allow us to understand causal pathways over time. And there are multiple ways to get into that. Definitely one of the more promising ones from social sciences is agency structure, the Archer kind of way of looking at how these two kind of interact over time. Now, comparative studies is the next one. We have that opportunity right now to much better compare what's happening in different kinds of countries because of the publication, because of the research capacity that's been growing, but how do we compare settings in a better way? And then last one here perhaps is better integration of methods from both quantitative and qualitative nature. We use them right now. Often, in fact, we just kind of mix them in a bit of a pragmatic way. But I think if you really want to understand the kind of causal pathways that we need to understand, the complex ones, we'll have to find ways to learn from qualitative research as well as from quantitative methods. And so a lot of progress has been made in a lot of other disciplines. And I think a lot of the innovation that we seek is actually happening already in fields like definitely ecology, political science as well, social sciences. The cross-fertilization is not yet fully maximized, I think. Now, second one is in terms of theories, it's which kind of theories do we need? And definitely, again, in terms of decolonization, how are we going to get rid of these weird theories? And how are we going to develop and test theories in particular settings, in the local kind of context, while at the same time, at the next level, kind of jump out of the local setting and arrive at transferable lessons. And so therefore, theory building and theory testing, I think, is the pathway to follow there. So I think it's really the moment to kind of take stock again of what we did in the past in terms of methods, in the terms of theories, but really go further now and try to open again that black box of causal complex pathways. Now, the thing, why is that important? Not so much because health systems are complex in nature, but I think, and again, that's a bit of a disappointment I had in the last HPSR symposia is kind of, are we paying really attention to the really complex issues that face us as a planet right now? There's urbanization, aging, of course, the kind of increasing inequities, aging populations in general, and the mix of all kind of health determinants. But what about climate change? And so that's talking to paper number 1 now. But I think in terms of the topics which have been raised already for the discussion of paper 1, we will need, in fact, much better toolkits to deal with these complex issues. So I'll wrap up at this stage. Happy to have questions later if needed.
Thank you so much, Bruno. Again, a really rich set of reflections. And so both of our discussants have raised some foundational framing issues for us, but also have given us some quite discrete and concrete things to think about, and have both really actually pointed to the issues of power and how we actually do the research. So with that, I'm happy to turn over to my colleague, Dr. Zubin Shroff, to lead us through paper 3. Zubin, over to you.
Thank you, Aku, and thank you to the discussants so far for the very rich in comments and feedback on what we've proposed. And great to be here. So I'll be providing an overview of paper 3, which really is on enhancing HPSR impact and what approaches should we be taking to the conduct of HPSR towards enhancing impact. Could I have the next slide, please? So the problem and how to address it, this is what I'm starting with. HPSR is an applied field, and we hope to be able to have impact on policy and practice, a very important attribute that we've highlighted right from the time of the HPSR reader in 2012, about it being an applied field of knowledge that seeks to bring together these different disciplines towards enhancing and strengthening health systems. And I think while a lot of investments have been made in HPSR, and as Kumanan pointed out, we're no longer in HPSR's infancy. There's an increasing sense amongst a lot of the community about the need to do more to enhance impact. And I think that this is being particularly accentuated in the current era of resource scarcity. We're dealing in a world where there's a lot of questioning of research more broadly and evidence more broadly, and therefore the need to show impact has just become more and more urgent. Now, what do we need to do to enhance impact? And I think this is where we come to the questions of impact for whom and for what. And I think we need to, as Asha mentioned, bring back the sort of move away from extractive research, interrogate who is involved in research process and in what role. How do we maintain, as she rightly pointed out, about dignity of people towards enhancing impact and uptake of what we do at community level, at the level of policy and practice? How do we engage power and politics, very linked to this previous point, and how do we really reflect the field's values? We talk a lot about the field really enhancing, engaging the issues of equity, addressing power imbalances, but how do we ensure that HPSR and how it's conducted at the level of policy and practice and implementation actually reflects these values? And how do we better collaborate with institutions at national and subnational level, again, towards ensuring and enabling what we ever generate to actually have impact? We've invested a lot in and theorized a lot on co-production and the embedded approach. We've had a lot of research using these approaches been carried out in countries. There's a wide spectrum of ways in which we've implemented the embedded approach. We've had the sort of typology which we developed a few years ago, in collaboration with colleagues at UCT. But there is still a sense that we need to do more to be able to actually do this better and enhance impact. Could I have the next slide, please? So here the paper really will reflect on experiences of applying these approaches to co-production and the embedded approach to research. And we want to understand how these approaches and the mechanisms through which these approaches have had or not had impact, and how these sort of interact with issues of structural issues such as financing, because it's much more than just the funding of HPSR or the funding to carry out the embedded approach, which has been done for quite some time to actually make this a reality. We want to provide practical recommendations on what global research funders, national research funders, again, increasingly important in many settings as aid recedes, policymakers and development practitioners can do to maximize the potential impact of health policy and systems research. And could I have the next slide, please? And we really have 4 objectives in this paper and what we want to get out of it. And as pointed out, Karen pointed out, this is also part of, it's not a research paper. We're really looking at this as a methodological musings paper. So we want to identify relational, institutional, political preconditions or ingredients necessary for HPSR to have impact. In the relational, we want to look at things such as trust, legitimacy, and mutual respect. You want to understand organizational incentives and capacities for collaboration, the role of leadership and policy alignment and national involvement and how that influences the ability to actually have impact. And for each of these, you want to identify indicators of presence and risks when absent. So we want to identify, for instance, do long-standing collaborations, how do those have impact the relational preconditions? How does having units for research, dedicated research units within ministries actually influence institutionalization? And what is the role of, say, ministerial endorsements or actual funding provided by governments themselves reflect sort of political will? We also want to identify risks such as tokenism, which is often cited as a big barrier to actually having impact at national level. We have tokenistically provide research funding to policymakers and leave it at that, and then don't actually bring about the power shifts that we talk about or that we claim to do. How do we move away from reliance on individuals and institutionalize research units, for instance? And of course, that involves dealing with things such as government turnover. And how do we get political buy-in, real political buy-in in the long run to move away from just purely instrumental, very short-term uses of research to already sort of validate things that have already been decided. The second objective is to actually examine the enabling environment and mechanisms through which these conditions have influenced sustained uptake of evidence. And here we will, in the methods, I'll reflect on how we're going to look at individual cases where we think the embedded approach has worked, or co-production, instance of co-production where we've seen real sustained change, to sort of reflect on what enables it. Could I have the next slide, please? We want to explore how these partnerships have been created, what are sort of ingredients to establish these partnerships, to create the preconditions necessary for impact, overcome the obstacles that come in the way of impact. And then we want to propose what we term a typology of readiness to serve as a planning tool. We want to identify is a setting low readiness, emerging readiness, or high readiness for having impact of HPSR. And for each of these readiness features, we want to identify what are features of the different levels of readiness, and also provide guidance on how to move to the next level of readiness. Could I have the next slide, please? So we want to do this through looking at least 3 instances where people have previously engaged in embedded HPSR or co-production, which we think would provide a sort of in-depth cases that could provide the needed evidence. We want to also interview 8 to 10 different stakeholders, drawing on the wide range of people involved in embedded approaches. And we also, then, of course, want to build on previous work that has been done. But very importantly, we don't want this to just become a summary of what has previously been done in terms of the enablers and barriers to the embedded approach, but also use this to actually generate a sort of actionable typology which people can use to move from one state of readiness to the other. So that's what this paper is about. And the sort of questions I have, could I have the next slide, please? It would be great to have some feedback on the kind of initiatives we could examine. We have some in mind, but I think that would be great to have more examples. Is this paper, are there any other objectives the paper should be addressing? What can be done to strengthen stated objectives? And importantly, now that you've heard all 3 papers, how to improve alignment across the 3 papers. And to discuss this, could I have the next slide, please? I'd like to invite Professor Helen Schneider to provide her reflections for the next 5 minutes. And for the audience, sorry, Helen, just before you come in for the audience Q&A, if you could type in your questions for all 3 papers, because we won't be inviting people to raise the questions, but really you can type them in the Q&A. That would be very useful for the next section. Over. Thank you, Helen.
Thanks very much, Zubin, and thanks to the Alliance for this initiative and the incredible points made by the co-discussants before me. So I thought this abstract read well. It seems to me quite a sound and coherent piece. I very much liked your foregrounding of context here. And I think that's something that the others picked up in relation to the other papers. And in your presentation, you also started to grapple with this question of what do you mean by impact? Because in this holy grail of impact on policy and practice, of course, you need to problematize what you mean by impact. So that is going to have to be part of the preamble, I think, in the 3,000 words you have. I wouldn't add objectives. I think you've got quite a lot here. But, have some thoughts about the individual objectives. So to a point also made by Bruno, your first objective around the institutional, political, relational context is a kind of snapshot, synchronous approach to context, whereas context is dynamic and fast evolving. And if one thinks about political windows of opportunity, how agendas are set over time, the confluence of events, that actually, if one thinks about impact as trajectories over time, what is relevant as an agenda for research and how that agenda might find its way into impact will vary tremendously over time. And that has particular relevance in thinking about an environment of increasing acute shocks and stresses alongside chronic, long-standing ones, and the need to therefore develop the institutional capacity to be strategic actors, actually, in a fast-evolving world. So that's to the first objective. The second on the mechanisms and enabling environments. So that's really about the pathways through which research finds its way into policy and practice. And, your preamble suggests otherwise, but when you say what constitutes the uptake of evidence into a policy and practice, you're already positing a hierarchical approach to thinking about knowledge and how knowledge is produced and how it shapes policy and practice. Whereas I think a complexity and a learning health system informed approach would say that knowledge mobilization happens through policy and practice and through deliberation alongside formal processes of research, and that is equally important and equally generative and necessary, actually, for thinking about impact and change in the real world. So that was the one thought. The second is the importance of not becoming too reductionist. So again, change often happens, unpredictably and accidentally. And it's only with hindsight that one sees the obvious causality. But that one should embrace, first of all, complexity, but also diversity here. So, the pathways will depend on what is being studied. Is it high or low politics issue? And then the related questions of so what and what next related to the issue. Is it a micro issue? Is it a meso macro issue? Who is doing the work? How are they doing it? And where? And then when. I've spoken about the policy process and cycle. But, and paper 2, wasn't really raised in the discussion, but speaks to some of the institutional forms. And I think there is a big question many of us are asking is where is HPSR best conducted, actually, if one thinks about it and if one looks critically at where we've been doing it in the past. And so I think all of that has a bearing. And so there will be not one single pathway or even handful of mechanisms, but multiple ones. So that if one's thinking about case studies, examples that one could draw on, I think therefore you need something that grapples with the multi-level approach that Bruno was talking, the micro, macro, meso, to really interrogate where one's kind of locating oneself in that. And of course, this also speaks to the readiness framework And then, what are some of the routine mechanisms? So, does government hold routine priority setting exercises that includes health policy and systems research to define essential national health research agendas, those kind of overarching routine and macro processes, with much more the ongoing relational and informal at meso and micro that are generated over time. And if you've been in one setting worked for 35 years like me, you begin to understand how important those relationships over long periods of time and how they go up and down. And then that's distinct with more episodic forms of research around particular issues. So all of that would have implications for thinking about how to understand impact and the mechanisms and what case studies you draw on, but also how you begin to put together some kind of typology of readiness. And I would caution against being reductionist, actually. What frameworks and recipes have limits. They're not reality. They're heuristic to understand the world. But actually, if one wants to be an actor in the world, you need to be able to think strategically, and you need to be able to navigate a complexity, to be able to read emergence, to see leverage points. That kind of ability is actually finally critically what's important in terms of capacity. So those are just some preliminary thoughts. There are lots of case studies in my own world, South Africa, Western Cape, longitudinal approaches, and from many other settings that we could draw on. Okay, over.
Thank you. Thank you so much, Helen. Unfortunately, Dr. Sengubai isn't here. He's unable to be with us right now. I'll then hand over to my colleague, Robert Martin, to lead the Q&A for the remainder of the period we have. Thank you very much for those insights, Helen.
Excellent. Well, thank you very much, Zubin. Thank you as well, Helen, for those comments. Thank you, Aku. Thank you, Asha and Bruno. I think, colleagues, we've now heard about all three of the papers. We've had some initial reflections, but there's a lot of experience, a lot of expertise, a lot of knowledge and learning in the room, so to speak. I see we have a great group of participants. If colleagues would like to ask questions, please feel free to put them in the chat. I've seen already a couple about the importance of looking at political economy, of the importance of medical anthropology, of thinking about, research versus learning. I see there's a question now for Kabir, specifically from Josephine, about the plea to distance HPSR from global health. How should we change the structure and dominance of some actors in this domain and debate? Colleagues, if there's any other questions or comments, I would invite you to put them in the chat. In the meantime, what I thought I would do is maybe just start with our respondents. So Kabir, Karen, Asha, Bruno, and Helen, maybe we could start from the beginning and say, Kabir, Karen, are there comments or questions that you've heard now in the discussion that you want to reflect upon? There's another question here also in coming back to thinking about where does our variability lie? Where should our focus be? What should be the unit of health systems? Kabir, here's another question for you about the gap in health systems innovations. A lot of good questions, of course, and I think another comment that we saw earlier, I think this was Helen, the kind of risks of reductionism. Of course, I mean, I think we've only have an hour and a half here. and to go through these papers quickly. So colleagues, do forgive us if we are sometimes overlooking some of the context, some of the complexity, and we are reducing some of this. But we wanted to make it presentable, of course. So Kabir, maybe there's a couple questions specifically to you, if you want to offer just a couple minutes quickly, and we'll try to come to all of the respondents before I go to Aku and Zubin for any other remarks before we close. But Kabir, do you want to open?
Thanks, Robert. I'll try and keep it brief. And I'll try and cover some of the points. So I think the question on global health, I already alluded to a little bit. I think it really reflects on a bit on Helen's point about not being reductionist and how we think about and looking beyond our immediate terrain of where we work and what sort of institutions we are located in. I mean, health systems has been grown as a field from public health institutions, and that's why we see it in that vision. But actually, there's a lot more to it. I mean, just to give two examples. So just specifically on the global health point, it's a problematic construct. No, there's no certainty on what it is. And it tends to be driven by trends rather than by locally determined phenomena and issues that people face. So that's the issue. Whereas on the other hand, health systems are always going to be there. Health care is always going to be organized in some fashion or the other. So that's a constant, and that's what we should be focusing on. Just to give two very quick instances. The first is we definitely need a deeper understanding of the role of commerce and its role in shaping healthcare. It needs to go beyond a determinants-based kind of thinking, because what that does is it places commerce outside of healthcare and says, oh, look, that's a context we need to look at. And it's Talib Mirzoev who once said that you just draw a circle around anything and call it context. No, that's not how we should be looking at it. Context is imbued. So commerce is driving most of healthcare in the world. And just as an example, a colleague of mine is doing some research on private equity investments in healthcare, which are increasing exponentially, especially in low and middle income countries. That's going to completely transform the whole concept of the fact that healthcare is mediated by professionals. It's going to be now much more focused on the bottom line. So, we need to be sort of tracking some of these trends more actively. Another thing I think we don't really focus on is health production. So I think that's we need to start again focusing. When we talk about decolonization, we also need to focus on indigeneity as the converse. What are the perspectives of people and communities when they view health systems? Is there an indigenous understanding of health systems which is different from how we perceive it sitting in our various towers? So, and that's like, how is health produced through social bonds, through family care, through community care, what is now being referred to as self-care? But of course, that again is very subject to commercial and market determination. But and that of course then gets mediated by the digital revolution, where now you can access healthcare through an app, or you can do pharmacy through on your mobile phones. So there are, but there's also a different way of looking at health, and which is not just about protecting health and caring for health, but also producing health, which I think is an important aspect which we can draw on from the traditional medicine sphere. So I'll stop there, but just opening up some ideas.
Excellent. No, thank you, Kabir. That was really helpful. Karen, any comments, reflections from you?
Yeah, I mean, I thought that everyone's comments tonight were super fascinating and very thought-provoking. When I was reflecting on this to put my notes together for it, I felt like one of the things that perhaps we had accomplished over the last 15, 20 years of doing HPSR is sort of a general understanding of what it is we're talking about. But tonight's conversation has made me sort of re-question that in terms of exactly, are we all talking about the same thing? What is the boundary for what it is we're talking about? And I don't have the answer here, but I think we are a field that is evolving. It's definitely not something like a discipline. It's interdisciplinary. It's broad. It's engaging. It's complex. It's challenging, but it isn't everything, I guess, is my point. And so I wonder, perhaps the boundaries have shifted out a little bit over time, but where do we draw that line? Again, for the purposes of this exercise, which is to write these 3 papers and, to sort of take a stock in terms of where the field is do we have agreement on where those boundaries are and what it all entails?
Thank you, Karen. Really, really helpful. Asha, do you have any final comments, reflections?
Yeah, I put a brief chat in the in a comment in the chat, and it's really reflecting a little bit about I talked about critical engagement. You know, we really do I really support co-production, co-design, but that doesn't mean there's also value in having that an independent perspective. It doesn't mean that, and preserving that is important. And I know there's this sense a little bit I'm getting that, oh, academics, is not a space that HPSR should be. But if you see academia as an accountable arena of knowledge production, it also gives you a foundation to support relationships that generate learning and change. But it does afford you, maybe not in the way academia is now being marketized and defunded, but that independence is also important in that critical engagement. And I'm just reflecting in my own experiences. I've worked on two very different projects, one at a district level with a local partner, and another in evaluating how the global financing facility works. And in both instances, the research process led to some uncomfortable truths. And if I had been a consultant hired by either partner to just solve, to support learning, there would have been no broader learning. It would have been a report that went to Washington or a report that sits with the health department. And, I do want to stress, and that it's not that everything needs to be published, but preserving that basis for independence. And that comes with certain elements of how do we make sure that you're a trusted partner. But that doesn't mean burying uncomfortable truths. It's how do you facilitate knowledge as a way of bringing that into the conversation. And it's something that's very hard to do. And I don't know that we always do it well. It is part of using research, having a political approach and a certain level of a certain type of values and ethics in that engagement, which is really important. So I just wanted to balance that co-design is not necessarily that everyone wants to agrees on what the topic should be, how it should be done, or even some of the results that come out from that. And we need to preserve that space for learning and engagement. Thank you.
No, thank you for that very nuanced point, Asha. I think the importance of the possibility and the responsibility of independence is very important. So thank you for that. I think that's very well taken. Bruno, would you like to offer any final reflections, comments?
Yeah, it's kind of building on what Asha said. At the same time, co-production is quite a connector between the three papers in a sense. It's about what do we do and how do we do it. So the first and second paper, but also the why, connecting to policymakers, but do it in such a way that you start from the beginning in that kind of engagement. And so co-production, yeah, it should be critical, definitely. And that's also where the political economy point of view comes. I think in a lot of the research we do, we lack that critical perspective, and we should bring that much more to the front. Co-production has been touted as kind of the thing to do, and I think for multiple reasons. Ethically, it's correct, of course. To deal with uncertain complexity, co-production is the way to go. And in terms of doing good research and setting priorities together, yes, for sure. In which conditions it works, that's something else. And I think it's almost research agenda in itself. How in these kind of praxis situations learn and build knowledge in a systematic way, that's again the theory building and the theory testing. And I think, so the connection I see between these, but there are of course multiple connections to be drawn there.
Excellent. Bruno, no, thank you for those comments. And I think That resonates also with a comment here from Steph Top talking about the kind of how and how we work as a community using kind of illustrative examples. Steph cited a paper on power that came out of Health Systems Global a few years ago. Helen, do you want to have any final comments or reflections?
So I had the benefit of hearing everyone before, and I think I can engaged already. So I'm ceding my comment time back to you, the Secretariat. Yeah. But
Thank you,
thanks for a
Helen.
great webinar. Yeah, really
Thank you. No,
interesting.
thank you, Helen. Always, yeah, living your values. Very much appreciate that. Zubin Aku, any final comments or reflections from either of you?
Aku, go ahead.
Thanks very much, Zubin, and just wanted to thank everyone for, again, just a really thoughtful discussion. And I think the one word that comes up for me that cuts across the three papers is the word facilitation, which I think, Asha, you mentioned it, but really all of the comments sort of alluded to it. And it's this idea of how does health policy and systems research be a facilitator to facilitate change, to facilitate empowerment, to facilitate learning. But then there is also that piece then about the one who undertakes health policy and systems research, and how do we learn to be better facilitators, regardless of whether we are in practice or whether we are in academia. And so I hope that as we grapple with these three papers and we come back to the community as the papers are being developed and finally launched, that idea of facilitation will become a little bit more clear to us. Thanks.
Thank you, Aku. Zubin, anything you would like to add?
So thank you everyone for those comments. I think I take away two things. One is, of course, this constant tension we have in HPSR between being apprehended complexity and yet trying to provide solutions to audiences who don't necessarily understand our field that well. So I think that caution of don't be reductionist while still trying to reach out to people who are beyond the community. And then also I liked Asha's reflections on the need to keep space and everything need not be co-designed, but the importance of also having some space where HPSR as a field can grow. But I think that's part of the same balance which we ought to maintain. But overall, thank you very much for your inputs, and we'll take these into account as we develop the three papers. Back to you, Robert.
Excellent. Well, thank you, Zubin. Thank you, Aku. Thank you, all of the respondents. Thank you for all of you for participating. I think this has been a fantastic discussion, very rich, very deep. This webinar has been recorded. We will make it available. But just to say for now, a big thank you to all of you. We will look forward to continuing the conversation, to trying, as Aku said, to facilitate this process in a way in which we include and can invite all of you to participate and use your independence, use your ability to engage, to hold us accountable. We are looking forward to working and facilitating these papers over the next year. Yeah, roughly, I think year. I think by the end of next year, we should be able to share these, and looking forward to that. So again, just to close on a big thank you to all of you. We will stay in touch. Thank you again for today.